Hello, this is Dr. Nagy Youssef. I'm a faculty at Duke University at the Brain Stimulation Division in Neurophysiology. And I do ECT as part of my practice. I also have a clinic that specializes in treatment-resistant depression and do inpatient, outpatient consult for ECT and transcranial magnetic stimulation. I'd like to talk with you about the indications of ECT. ECT is an old treatment that survived for over 70 years. The way we do ECT now is very different than it was done in the past. Of course, under anesthesia and muscle relaxation, and the evolution and adjustment of electric parameters has improved a lot, the practice of ECT. And a lot of times we now consider it for patients who are very medically sick, like patients in the ICUs. Sometimes it's more effective and also safer than adding medications in some patients. So indications of ECT are various, but most common indications, as you probably know, is mood disorders. People who are depressed, whether major depressive disorder or bipolar disorder. That's the most common patients refer to us. Of course, ECT is also very effective in manic patients or mixed. ECT also can be effective for catatonic patients, a lot of time in hospitalized patients in either psychiatric or medical units, and it can work after trials of benzos or before. Patients we see sometimes would rather do ECTs than take medications. That could be a small portion of patients. But ECT also can be very helpful for patients who've tried several medications, have not responded to it, and are acutely suicidal or not eating and losing a lot of weight or really impairing their functioning. We also see patients that have done ECT in the past and came back because it was very effective for different depressive episodes. We see patients who have family members in ECT found it very effective and actually are referred by family member. The way ECT is done today, as I mentioned, is a lot safer. So electric parameters in the form of now a rectangular pulse rather than the old sine wave. The ultra-brief pulse, which is a much shorter duration pulse of 0.3 millisecond, has improved a lot the side effects of ECT, mainly cognitive and memory problems, memory deficits. That becomes a lot less common with that, along with the unilateral placement of electrodes versus the bilateral, and other modifications in the parameters that has been done over the year. Not only decrease the side effects, but made induction of therapeutic seizures more efficient. Also, the way anesthesia is done now made it a lot safer. So, as I mentioned, there is risks, which most commonly and the one most important patients want to know about is memory deficits and cognitive side effects. However, this has been reduced to a great deal. A lot of patients would recover most or all of these memories after an ECT course. There's always a small percentage might have some deficits in some events in the past. But again, a lot of patients would tell us that the efficacy of ECT is really worth going through. Of course, we see a small percentage of patients who are treatment resistant. Of course, ECT can be done for non-treatment resistant patients, but commonly patients are referred to us after different and many trials of medications. Thank you.